health care issues from Lehigh Valley to the west lawn of the U.S. Capitol and is published in numerous major daily newspapers around the country. A Penn State trained journalist, she edits an online newspaper, Liability and Health Reform Update. A 15-year breast cancer survivor, longtime spouse of General Surgeon Peter F. Rovito, MD, and mother of 2 sons, Donna brings a balanced, real-life perspective to the medical issues we all face in these uncertain times. Donna has also agreed to co-chair the Grassroots Coalition, Healthcare Professionals for Romney. Donna is a lady who was in the fight and on our side. I'd like to introduce her now, and any questions will be taken after all 3 people have made their presentation.
Thank you, Charlie, for that very kind introduction. Yes, I have been married to a surgeon for a long time. But I don't see him very often, so it doesn't seem all that long. Words mean stuff, you know? In recent times, those of us who support limited government and fiscal responsibility have been called all kinds of nasty words by people who pretty much get a pass for it. If you're a liberal, and she's not, it's okay to use the C word to describe an American woman. But if you're a conservative, God forbid you should use a considerably less objectionable term. Words mean stuff, but apparently not the same stuff for everyone. If you carry a flag, God forbid a Gadsden flag, and say the Pledge of Allegiance and pray before an event, kind of like we did here tonight, you might be called a terrorist by the head of Homeland Security. But if you defecate on a police car and smash the windows of a bank, you just might be called a patriot by the former Speaker of the House, and the President of the United States will give you a wink and a nod. If you support religious freedom and believe government can't force religious institutions to provide health care benefits that go against the teachings of that religion, you've declared a war on women. If you support traditional marriage, you've declared a war on homosexuals. The people in Washington know how powerful words can be, so they make sure to give the laws they want to pass names that make them sound attractive and reasonable. Strong, positive-sounding names with cutesy acronyms, like the title of the new health care law, the Patient Protection and Affordable Care Act. It sounds good, doesn't it? I mean, who doesn't want to protect patients, right? And who doesn't want care to be affordable? And since the title of the law says that the law will protect patients and make care affordable, well, why wouldn't reasonable people support it, right? The thing with words, though, is that you can make them tell lies, big lies, whoppers, like the title of the new health care law. What it actually does is exactly the opposite of what it says it does. Supporters of the law said something had to be passed because 51 million Americans were dying in the street for lack of health care. That, of course, was the big lie upon which a lot of the other lies were based. Here's a number I'd like you to remember. Of that 51 million Americans, and for the sake of argument, we'll pretend that number is accurate, which it's not. But for the sake of argument, let's pretend that it is. Of that 51 million Americans who were uninsured, 23 million of them were people who were either eligible for existing government programs but hadn't enrolled, were uninsured between jobs or for a short period of time, or made enough money to buy insurance and chose not to, which is something Americans are still allowed to choose for themselves, depending on what the Supreme Court says in the next couple of months. So please remember that number, 23 million Americans. We'll be coming back to it later. Those who support the health care law claim it will provide better access for patients, improved safety and quality, lower costs, and preservation of the doctor-patient relationship. I got that note last week from a doctor who supports the health care law. He's one of the very few, just so you know. Better access? No, afraid not. There are no provisions in the law to increase the number of physicians to provide all the free care promised by the bill and the essential benefits that are currently being written by former trial lawyer lobbyist Kathleen Sebelius. There are, however, lots of ways for physician extenders like nurses, physician's assistants, pharmacists, and other people who didn't go to medical school to move into practice areas traditionally reserved for the skills and education levels of MDs and DOs. They have the support of the President of the United States, who says that a physician's assistant or nurse practitioner can do 90% of what a family practice doctor or pediatrician does. The FDA is considering allowing patients to decide what medication they need for their high blood pressure or diabetes or other chronic diseases. Who will get sued, I wonder, when patients malpractice on themselves? Somebody will. Trust me, somebody will. Patients demanding their mandated free benefits will fill doctors' offices seeking the Obamacare they're entitled to, making it difficult for sick patients to get timely care. On a side note, I personally know of a doctor's office in the Lehigh Valley that got a phone call the day after the Patient Protection and Affordable Care Act was passed. She wanted an appointment that very day to get her free Obamacare. The funny part was that it was a dermatologist's office. And she was quite annoyed when she found out that A, they couldn't see her that day because the doctor had about a 6-month waiting list, and that's before Obamacare kicks in, and B, her care wouldn't be free.